Now, what are the causative factors that can result in these particular sellar masses? Obviously, there can be a lot of congenital conditions that can give rise to this particular mass-like lesions that are present in this particular area of sella turcica. On the other hand, it can be the localized tumors that can arise in this particular area. Moreover, we can have the metastatic tumors that can move on to these particular areas. Whatever the cause is, we must know how to basically start off with the history taking. When you have these patients, you must know how to move on with the history. Obviously, the presenting complaints is going to highlight a lot of factors, what particular area is involved. And then, obviously, as we even saw in our case study, we'd be moving on with the particular radio imaging techniques. For instance, we'd be carrying out the CT scans, we'd be ordering for the MRIs, and we would be basically focusing on the areas that are being involved and what are the mass pressure symptoms that are being impended on the areas or on the structures that are present laterally, superiorly, inferiorly, or anteriorly and posteriorly. All these relations have to be taken into account and that is basically going to depend upon the underground or the background anatomical knowledge of this particular area. So you should be well versed with the different structures that are present over there and what can be the pressure symptoms that can arise in a particular patient, and obviously then you would be carrying out the particular history. The history of present illness would be discussed in detail over here. You'd ask for the features, how did they arise, and what was the course of the illness in this particular patient. For instance, we can have an acute course, as well as we can have the chronicity of the symptoms that are seen with a lot of conditions. So it's basically going to narrow down the differential diagnosis for you. When you know the course of illness, either it was an acute onset or either it was a chronic onset. For instance, if we take the symptom of headache, you can ask if it is associated with what kind of a headache, what is the nature of headache, the nature of the pain, whether it is throbbing, whether it is continuous, whether it is a cluster kind of a headache. That is usually associated with the pituitary tumors in this particular case. And then obviously, how does it go away? Does it respond to any kind of painkillers that the patient might have been taking? And obviously, if it is associated with visual disturbances, with nausea, with vomiting, these associated symptoms are also going to be taken into account when you're taking the detailed history of the headache in this particular patient. Then moving on to visual disturbances. The patient also presented to you with visual disturbances. So you would basically enhance upon the factor and you would rule out the other causes which can even result in visual disturbances. For instance, you would ask for any kind of corneal displacements. The conjunctiva is going to be taken into account if or not the patient is suffering from a cataract, and that would obviously basically require the history in detail. The family history is very important over here. The past history is very important. Sometimes the patient is going to give you major clues. That is basically going to highlight the fact that the headache is basically not associated with the visual disturbances, and it's basically an entirely different symptom that the patient has. Glaucoma, the history of glaucoma has to be also taken into account, and the examination is again going to reveal a lot of factors. When you would be basically examining the eye of the patient in detail, then you can relate whether these symptoms are occurring individually, apart from the fact that the patient is not suffering from any corneal, any conjunctival, or any retinal pathologies, and it's basically an entirely different entity. The patient is just suffering from visual disturbances and something central in nature. There are some central causes that are basically resulting in this particular visual disturbances in the patient. So you would basically go step by step and enhance or basically find evidence towards the factor that there is some kind of a central cause towards the headache as well as the visual disturbances. When you'd be carrying out the radio imaging techniques, and obviously then you'd be offering or ordering for the laboratory investigations, that is basically further going to make things easier for you to diagnose what is the underlying cause for these particular features in this patient that we're going to study. So the causative factors, we can just have this flow chart in our mind, and it's basically going to make things a lot easier for you theoretically as well. And as well, clinically, when you're working on your wards, it's basically going to help you a lot if you just have all this information in this particular kind of a way. First of all, first and foremost, it can be the benign tumors. And the benign tumors, we have the list of benign tumors. We can have the pituitary adenomatous tumors. Then we can have the craniopharyngiomas. And primarily, it can be even the meningiomas involving the protective coverings or the meninges in the patient. So it can be the pituitary itself, which is involved in the mass-like lesions. It can be the coverings of the pituitary, and it can be the particular congenital tumors, congenital conditions as well. So the list of benign tumors is basically shown over here. The pituitary adenomas are quite common, and the case study that we are discussing on right now is also referring to this kind of pituitary adenoma. As you would be looking at the features, there are pressure symptoms laterally and as well as on the optic chiasma. It can be the pituitary adenoma involving the anterior lobe, or it can be featuring just the posterior lobe. So whatever the case is, you're going to highlight these facts over here as well. So the pituitary abscesses are also basically can be one of the cause to the mass-like lesions that are present. Infectious conditions can be diagnosed whenever you carry out the blood counts. That is basically going to show a raised erythrocyte sedimentation rate. That is the increase in the ESR. WBC count is sometimes increased. And these abscesses are sometimes formed locally, and sometimes they drain through the neighboring structures. So even the radio imaging techniques is going to relay to this fact that whether there are some other neighboring structures that are involved in this infectious condition or not. Then we can have the condition of pituitary hyperplasias, and it can sometimes occur in the lactotroph hyperplasia, and it can be sometimes a thyrotroph, which is primarily releasing the thyroid hormone, and a hyperplasia, which is again releasing the gonadotrophic hormones. Then we have the somatotroph hyperplasia due to the ectopic growth hormone releasing hormone secretion. So it's basically, they're named accordingly, the kind of the hormones that they're secreting, and even the clinical picture is going to be accordingly. If it's a growth hormone, it's going to mimic a picture of acromegalic patient in the adults. And then we have if it is just the thyroid hormone, then it is going to just mimic a picture of thyrotoxicosis. And when we investigate the case further, it is going to highlight that the patient is suffering from this particular kind of the pituitary hyperplasia, which is resulting in the secretions of the thyroid hormone and the gonadotrophic hormones. Then we have the lymphocytic hypophysitis, and it's basically it is going to mimic an infectious condition, because lymphocytosis would be primarily the finding when we have the blood counts at our hand. This would be the particular finding over here. Malignant tumors are one of the mainstays. It can be the primary malignant tumors, and we can have the germ cell tumors on the other hand. We can have the sarcomas as well. And it's basically going to depend upon the differentiation that the cells are going to attain at their final stage. The chordomas are also sometimes seen, and then we have the pituitary carcinomas that are quite aggressive in their nature. And then the prognostic factors are also quite different in cases of the benign versus the malignant tumors. So the overall management and the treatment guidelines are also going to rely upon the fact that what kind of the tumor that we're dealing with. The biopsies are going to help a lot, and when we take the biopsies, we look at the cell differentiation under the microscope. That is going to basically make it much more simpler for a histopathologist that what kind of a tumor that we're dealing in with, and basically highlight the prognostic factors for that particular tumor. Cancerous conditions can even metastasize from distant organs, for instance, the lungs. They can metastasize from the breast. And then we have the carotid AV fistulas, that is the arteriovenous fistulas, that can even have the pressurized symptoms. The carotids basically run through the cavernous sinus. They are the major content of the cavernous sinus, and sometimes whenever we have these fistulas inside these cavernous sinuses, they sometimes mimic a condition of masses in that particular area. So this can be one of the conditions. Then we have the Rathke's cleft. That is one of the cystic conditions. Now, we have to keep in mind that usually these cystic conditions are congenital in their nature and they are present by birth, and sometimes they don't even show quite a symptomatic picture in the patients. And the finding is usually incidental when you carry out an incidental MRI or a CT scan. It is going to show that particular kind of a Rathke's cleft. It's basically a collection of fluid that is present anteriorly to this particular fossa. And it is in close relation to the optic chiasma, so it's going to have these particular visual problems as well. So this is again a congenital condition that can arise in the patients. Then we have the arachnoid cysts, depending upon the arachnoid granulations that are present, and they're basically responsible for the secretion of the CSF, and that can even result in these cystic lesions in the individual. Moreover, we can have the dermoid cysts. Now, the dermoid cysts can arise anywhere in the body. They are congenital in their nature, they are present by birth, and usually they are going to contain different kinds of cellular conditions. It can even contain the hair, the skin. All of these are sometimes contained. When you have the biopsies, you are going to be looking at a range of cellular differentiation in these dermoidal cysts that are present in the patient. So looking at these range of causative factors, we must know that these are the particular causative factors, and we have to basically investigate the case further. Even the clinical features are sometimes going to rely upon the fact that what kind of a carcinomatous condition or what kind of a benign tumor we are dealing in with. What particular area is affected, it is again going to depend upon the fact that what is the localization of the tumor. So it is going to have a particular set of signs and symptoms. And then we again have to keep in mind that either we are dealing with an anterior pituitary tumor or we are dealing with a posterior pituitary tumor. Both of these areas have a different set of hormones that they're producing. For instance, the anterior pituitary is responsible for the production of the FSH, the luteinizing hormone, the follicle stimulating hormone. We have the growth hormone, the adrenocortical hormone. So it is going to have a particular entirely different clinical picture in the patient. On the other hand, we have the posterior pituitary, which is under the control of the hypothalamus and particularly under the control of the environmental stresses in the circadian rhythm. So the patient is going to exhibit an entirely different kind of a clinical picture. So we are going to inculcate the history along with the examination and the laboratory investigations, are going to make things easier for us just to pinpoint the exact definitive cause in a particular patient, and then we can have the prognostic factors accordingly, and we can basically manage the patients accordingly as well.